Chapter 13 considers various treatments as it relates to psychological disorders, and bear in mind that all methods of treatments will share certain basic features, including a client or a patient who seeks relief from some sort of problem, a person who is socially accepted as one who can help the client because of training or experience, and a special social relationship between the client and the therapist, all of which help to ease the client's problems. Of course, there are also theoretical explanations of those problems and a set of procedures for dealing with particular problems. Now, clients can be categorized as inpatient or outpatient. Psychiatrists are medical doctors who specialize in the treatment of medical disorders and can prescribe medication. Psychologists, on the other hand, often do psychotherapy work and usually have doctoral degrees in clinical or counseling psychology, but only in New Mexico, Louisiana, and a few other states are they able to prescribe drugs. The main goal of psychotherapists is to help people change their thinking, to change their feeling, and even their behavior so they can be happier and more productive in their everyday existence. So let's begin first of all with psychodynamic therapy. Freud's method of treatment, which is called psychoanalysis, attempts to help the patient understand unconscious conflicts and wishes and then work through those implications for everyday life. For classical psychoanalysis, free association consists of asking a client to verbalize thoughts, feelings, and memories that come to mind. The content and character of associations then contain clues to the unconscious material. In the interpretation of dreams, for example, the patient reports the manifest conflict or the manifest content, the surface story of a dream, and then works to understand the latent content or its unconscious meaning. It's represented by the client's dream symbols. The psychoanalyst looks for evidence that the feelings, reactions, and conflicts the client experiences toward others have been transferred onto the therapist. The process is called transference, and it may help the client reenact and gain insight into old conflicts. Now, there are a couple of contemporary variations on psychoanalysis. First of all, it requires much time, money, verbal skill, and abstract thinking ability. Those requirements also tend to limit its use. Variations in psychoanalytic treatments, such as ego analysis, de-emphasize the past and focused on helping the client use the ego to solve problems. Object relations therapy is a contemporary psychodynamic approach to psychotherapy. Therapists using this particular approach believe that personality is the arising conflict that causes problems that stems from the need for supportive human relationships, such as the mother-child bond. The therapist takes the active role in therapy and tries to establish a supportive and nurturing relationship with the client so that he or she can experience what may have been missed as an infant. There are other variations on psychoanalysis that include psychoanalytically oriented psychotherapy as well as time-limited dynamic therapies. The humanistic approach believes that behavior is shaped by the innate drive toward growth that is guided by an individual's interpretation of the world. The humanistic treatment is based on the following assumptions. First of all, treatment is a human encounter between equals, not a cure. Clients will improve on their own given the right conditions. An accepting and supportive relationship will support clients' growth, and clients must remain responsible for choosing how to feel and think. Another model in the humanistic version is called client-centered therapy. Carl Rogers proposed such a theory in client-centered therapy, also supposes that creating a relationship characterized by unconditional positive regard, empathy, and congruence become very helpful in the client-therapist relationship. Unconditional positive regard is when the therapist shows that he or she genuinely cares and accepts the client as a person and trusts the client's ability to change. Empathy is when the therapist must appreciate how the world looks from the client's point of view. Empathy is communicated through a technique called reflection. Congruence is the way a therapist feels, and it must be consistent with the way he or she acts toward the client. The therapist's unconditional positive regard and empathy are real, not manufactured. Gestalt therapy is another humanistic model. And the goal of Frederick Pearl's Gestalt Therapy is to help clients become more self-aware and self-accepting so that they can begin growing again in their own unique and consciously guided direction. Gestalt therapists encourage clients to become aware of real feelings that they've often denied and to discard foreign feelings, ideas, and values. Therapists are directive in helping clients focus on the present, not past feelings. Role play and imaginary dialogues are also two facets of this particular therapy. Behavior therapy includes therapists that assume a problem is learned, and it's also a pattern of thinking and behaving that can be changed without looking for the meaning behind the behavior. Basic features of behavioral treatments include the development of a good client-therapist relationship, a list of behaviors and thoughts to be changed, a therapist who acts as a teacher by setting and implementing specific treatment plans, and ongoing evaluation of the effects of that therapy. Treatment then utilizes classical conditioning principles and is referred to as behavioral therapy. Those utilizing operant conditioning are called behavioral modification therapists. Therapies that focus on changing thinking patterns as well as overt behaviors are called cognitive behavioral therapies. Now, what are some of the techniques involved in modifying behavior? We can begin with systematic desensitization. During that process, a client practices progressive relaxation while imagining a fear-provoking situation from an anxiety hierarchy. The process of remaining calm while thinking about something fearful weakens the learned association between anxiety and the feared object or the circumstance. Modeling is also another way of going about this particular type of therapy. During modeling, a client can learn about or even get comfortable displaying desirable behaviors. The therapist demonstrates the desirable behavior, and then the client gradually practices them. The client can learn to be more appropriately self-expressive and more comfortable in social circumstances through assertiveness and social skills training. Positive reinforcement is when the therapist systematically tries to help alter behavioral problems. The receipt of rewards or tokens is dependent upon a client's display of desirable behaviors. In institutions, behavior therapists sometimes establish what's called a token economy. Extinction is another humanistic method. It's when behavior is modified by removing reinforcers that normally follow a particular response. A procedure called flooding extinguishes a classically conditioned fear response. It keeps the patient in a feared but harmless circumstance. As a result, the client who is deprived of a normally rewarding escape pattern has no reason for continued anxiety. Aversive therapy is a technique that uses classical conditioning to reduce undesirable behavior by associating it with some psychological or physical discomfort. Punishment is used to eliminate a dangerous or disruptive pattern. An unpleasant stimulus is presented after the behavior, which reduces its occurrence. Now, from a cognitive behavioral therapeutic perspective, such a therapy can help people change negative thoughts, which then induce depression, anger, and anxiety. Rational emotive behavioral therapy tries to eliminate learned problem-causing thoughts. Cognitive restructuring and stress inoculation, teaching or training, can teach a client new and calming thoughts that help him or her cope with stressful and anxiety-provoking situations. Now, Beck's cognitive therapeutic model rests on the assumption that a client has formed negative thoughts about him or herself and the world. Treatment involves demonstrating the inaccuracy of these thoughts by testing them. There are also a number of different ways to do group, family, and couples therapy. Group therapy is the simultaneous treatment of several clients by one therapist. There is no predominant theoretical approach to group therapy. Groups are often organized according to either a type of problem or one type of client. Group therapy has several advantages. The therapist, first of all, can observe clients' personal interactions. Clients can realize that they aren't the only people with a particular problem. Clients then can be supportive of one another, which increases self-esteem. Clients then learn from one another. Some of the advantages are put to use in self-help organizations. There's family and couples therapy as well. Family therapy is based in part on the idea that a patient's problems will stem from early family relationships and problems, as well as problems that are multifaceted and must be dealt with in the family system in which they're maintained. In family therapy, the entire family is considered the client, and the therapist attempts to create harmony within the family by facilitating each member's understanding of the family's interactions and how to help relate those challenges to certain problems. Of course, couples therapy focuses on communication between partners. Therapists and clients often set, quote, rules for talking, end quote, to improve communication skills. What about the potential of evaluating psychotherapeutic models? If it's important to think critically, it's important to consider all forms of therapy equally. But then the question arises, are all of those particular therapeutic processes effective? Different forms of therapy will be equally effective, independent of theoretical approach or methodology. Research meta-analyses combine the results of large numbers of therapy studies and have shown that psychodynamic, humanistic, and behavioral therapies can be equally effective. The interesting challenge is that meta-analyses may be unable to detect the effect of different therapies for different problems. Also, experimental models and conclusions may not take into account the personal qualities of the psychotherapists practicing in the real world and how they may interact with those clients. Some other challenges related to the focus on research methods. A task force once examined the outcomes of thousands of experiments involving psychotherapy methods used to treat different disorders. What they found is that certain therapies were identified as effective for particular problems. Those are called empirically supported therapies. The study, however, also focused on the therapeutic method only, rather than the characteristics and the interactions of the therapist and the clients, which could affect the therapeutic outcome. Future research should also include this facet as in both laboratory and naturalistic studies. Now, although studies are still addressing which treatment by whom is most effective for individuals with specific problems under specific circumstances, trends do show that behavioral and cognitive behavioral methodologies show advantages, especially for anxiety disorders. The client-therapist relationship in what we call approach-free factors is extremely important in the success of any therapy. When choosing a type of therapy, a person should give careful consideration to what approach he or she finds appealing, the therapist's track record, and the potential for forming a productive client-therapeutic relationship. Culture is also a significant factor as it relates to psychotherapy. A number of cultural differences may lead a client and a therapist to have different expectations and goals about a particular outcome of therapy and approach and methodologies used. Currently, psychologists are working to align cultural influence and the choice of a specific treatment. Also, mental health training programs are trying to recruit more students from varying cultures, and clinicians are being trained to recognize and understand cultural differences in verbal and nonverbal communication. Therapists deal with bunches of rules, and clients have also a number of different rights as it relates to the therapeutic relationship. The ethical standards of the American Psychological Association, for example, forbid a sexual relationship between a therapist and a client. The therapist must also hold whatever the client says in complete confidentiality. Now, there are some exceptions to that rule that include situations in which the client's current or historical conditioning is used as part of a civil or a criminal defense. The client is so severely disturbed or suicidal that hospitalization is required. The therapist must defend against a malpractice suit. The client reveals information about sexual or physical abuse of a child or incapacitated adult, or the therapist believes that the client may commit a violent act against another person. Clients are also protected against being placed or kept in an institution unnecessarily. A person threatened with commitment must have written notice, a chance to prepare a defense with an attorney, a court hearing with a jury if the client wishes, and the right to take the Fifth Amendment. Furthermore, the prosecution must prove that the client is mentally ill and poses a danger to himself or herself as well as others. Once in an institution, the client may refuse certain treatment, and states are required to review every case periodically to determine if the client should be released. There are also a number of different biological treatments that people can use for psychological disorders. They've been in existence since the time of Hippocrates. Methods used in the 16th through the 18th centuries included laxative purges, bleeding of excess blood using leeches, induced vomiting, cold baths, hunger, and other physical discomforts, all of which were designed to shock the patient back to normality. Biological treatments have also advanced considerably since that time. Electroconvulsive shock therapy was used in the 1940s and 50s to treat schizophrenia, depression, and even sometimes mania. Today, ECT is used primarily to treat severe depression in patients who don't respond to psychoactive drugs and are at a risk for suicide. ECT procedures have changed. Today, shock is applied to one hemisphere, and patients are given a deep muscle relaxant prior to treatment. Why ECT works in some cases is unclear. ECT is one of the most controversial biological treatments that's available. It's also considered to be a last resort in most circumstances. Another potential biological treatment, surprisingly enough, is psychosurgery. Psychosurgical techniques, which include prefrontal lobotomies, were once used to treat problems involving strong emotional responses such as schizophrenia, depression, anxiety, aggressiveness, and even obsessive compulsive disorders. Today, psychosurgery is done only is done only as a last resort, and it involves the destruction of only tiny parts of brain tissue. So, psychoactive medication is also important as it relates to biological intervention. Psychoactive drugs have largely replaced electroconvulsive shock therapy as well as psychosurgery. Medications referred to as neuroleptics or antipsychotics are drugs that are effective in reducing delusions, hallucinations, paranoid suspiciousness, and other severe forms of disturbed thoughts and behavior. Phenothiazines and haloperidol are common neuroleptics that produce improvement in 60 to 70% of patients. However, these drugs also produce side effects such as tardive dyskinesia and, in some cases, even death. Clozapine, which is a new antipsychotic drug, is equally effective and does not cause movement disorders. Antidepressants can be used by increasing the amount of serotonin or norepinephrine available at the nerve synapses. Antidepressants such as monoamine oxidase inhibitors, tricyclic antidepressants, and fluoxetine can produce a gradual lifting of depression, allowing the person to return to normal life. Lithium and anticonvulsants, such as lithium, are also associated with severe side effects. In helping to reduce side effects and even preventing both the depression and the mania associated with bipolar disorders, lithium and other anticonvulsants can be very helpful. Anticonvulsants are becoming more popular in treating mania. Anxiolytics, which were originally called tranquilizers, are the most widely used of all legal drugs. They relieve anxiety and tension. Some of them, however, are potentially addictive and, when mixed with alcohol, can have fatal consequences. What about the evaluation of psychoactive drug treatments? Although drugs can at times be very useful in the treatment of mental disorders, enthusiasm about drugs is not universal. At least 3 limitations are applicable here. Drugs may cover up the problem without permanently curing it. Second of all, drugs carry the potential for abuse, which results in physical and psychological dependence. And third, many drugs have undesirable side effects. Now, when it comes to using drugs with psychotherapy, it's unclear which is more effective in treating psychological disorders, drugs or psychotherapy. It has been suggested that where indicated, treatment begin with some form of psychotherapy and that drug treatments be added only if psychotherapy is ineffective. The community at large also plays a role in psychological treatment of disorders. Community psychology is a movement that attempts to increase early detection of problems and then minimize or prevent mental disorders by making social and environmental adjustments. How those particular adjustments occur depends on the circumstance as well as the situation and may change from community to community. If I can provide you with any other information as it relates to the basic treatment of psychological disorders, don't hesitate to get in touch. I'm not far away. I hope you're enjoying a little bit of cloudiness today, and perhaps you're beginning to get to the point of being able to get out of your house for at least a bit to encounter another human person. It's important that we're all in this process together.